We are in Liverpool in the UK, where I'm exploring the link between health and the availability of green space in an urban area. Diseases in urban areas have affected mankind throughout history. For example, the spread of cholera and TB in cities during the Industrial Revolution. Today, diseases such as heart disease, cancer, and diabetes are a leading cause of death. These chronic diseases cannot be prevented by a vaccine, but the way we live our lives can help to deter them. Physical activity, such as walking, jogging, and playing sports, is a key component to a healthy lifestyle. But having the opportunity to do this in a safe, clean, and enjoyable environment is often harder in an urban area. And with more and more people moving into cities each year, this is a problem that needs to be addressed. I'm going to show you two wards in Liverpool, one with an abundance of good quality green space and the other with very little. I've gathered my information from census results, a study on obesity rates for boys and girls aged 9 and 10 in Liverpool, and a council report on open spaces. Combining these results, I've explored the link between the amount of green space in an area and the health of the residents. So now we're in the ward of Vauxhall. Minus domestic gardens, only 4% of the ward is covered in green space, the second lowest out of all of the wards. Out of that 4%, none is of a good quality. When we look at the obesity levels, we see that out of all the wards, Vauxhall has the highest rate of obesity in boys aged 9 and 10, and the second highest rate of obesity in girls for the same age group. As part of the census, people were asked to report on their health, stating whether they were in good health, fairly good health, or not good health. Vauxhall had the lowest percent of people reporting good health. So, as we can see, the ward provides very little green space for people to exercise in or for children to play in. Is this a reason for the poor health results? So now we're in the ward of Aigburth. 48% of Aigburth is covered in green space. 83% of Aigburth's green space is of fair or good quality. The footage is of a city park in Aigburth called Sefton Park. The park was first opened in 1872. The residents in Aigburth also have access to a district park, public, private and educational outdoor sports facilities, allotments, natural green space and green corridors. Out of the 33 wards in Liverpool, Aigburth had the lowest rate of obese boys aged 9 and 10, and the 6th lowest rate of obese girls for the same age group. Aigburth also had the 8th lowest percent of people reporting not good health. This Victorian glass house was built in 1896 and is the centrepiece of the park. Unfortunately, after a period of decline and deterioration, the Palm House was closed in the 1980s. But the locals' love for the park and the Palm House was displayed when they began a fundraising campaign to restore and reopen the Palm House. Today, with the help of the locals, the council and the National Lottery Fund, the Palm House has had a £1 million revamp and is now open for everyone to enjoy. We have examined two areas in Liverpool. First, Vauxhall, with very little green space, high obesity rates and a low percent of residents reporting good health. And Aigburth, with large quantities of good quality green space, low obesity rates, and a low percent of people reporting not good health. Governments around the world often only spend time and money on projects that will produce clear results and benefits, and therefore they can be used as examples in times of elections. The benefits of good quality, accessible green space in an area is hard to calculate, and therefore green spaces are often ignored by governments. But with more research carried out on this topic, we can help to promote the benefits of green space.